Hello, friends. Today, let's talk about the Hipaa, which is a law that exists in the federal world. Let's try to understand what are the implications of this law, what are the effects of this law. So, full form of Hipaa, and many people confuse it with some other full form. But the full form of Hipaa is Health Information Portability and Accounting Act. The purpose, as we talked about already, it's a federal law provision by the HHS, the US Department of Health and Human Services. It's a federal law which was passed in US Assembly in 1996, which required the creation of national standards to protect the sensitive patient health information from disclosure without patient consent. It streamlines the healthcare system and administrative processes. The scope is to all healthcare providers. So, all the healthcare services, all the service providers, this law applies to all of them. So, basically, all the healthcare providers now they need to protect the health information of everyone in the US region before disclosing the health information. There are certain norms that they need to follow, and we'll discuss about them. So, what are we trying to protect here? We are trying to protect the health information. So, health information is any information that's related to patients' physical or mental health condition. It may be the past condition, the present condition, or any future provisions of healthcare that is required. And it also includes the payments that are made for these provisions. So, HIPAA applies to entities. What are those entities? They are medical practitioners like doctors, medical institutions like hospitals, clinics and nursing homes, health plans such as HMOs and PPOs. Generally, the HMO health maintenance organization is low cost, less flexibility plan, and PPO, which is a preferred provider organization, is a high cost, more flexibility plan. Then it applies to EPOs, Medicare and Mediclaim providers, healthcare clearinghouses, business associates. You can get more information about entities in hhs.gov website. Let us come to the principles of HIPAA. There are three main principles. The first one is privacy rule, which attempts to protect the information from disclosure. The security rule, which ensures the confidentiality, integrity, and availability. And breach notification rule. It's a rule wherein the entities are obliged to send a notification in case a breach occurs. Then there are other rules like enforcement rules. It talks about files and penalties. Then transaction and code set rule, which standardizes the e-transactions, and the last one, which is having a unique identifier for each service provider. So the privacy rule, the purpose is to protect medical records and information, which is also called protected health information. Many people confuse PHI with personal health information. It's not personal health information, it is protected health information. The scope applies to covered entities. We all know by now what are entities. What are the provisions? The key provisions are the privacy rule limits on PHI uses and disclosures for treatment, payment, healthcare operations. Also requires that a notice of privacy practices need to be sent to patient to inform patient of their right. It also gives individuals the rights to obtain a copy of their health records and requires the entities to disclose the PHI to an individual within 30 days upon request. If a request comes within 30 days, it should be serviced. Provide and disclose PHI as required by law enforcement. If there is a law enforcement agency that wants it, this information need to be provided to them. Then notify the individuals of the use. If this information is being shared, a notification need to be sent to patients. Then the entities need to keep track of all the disclosures, and they need to document the privacy policies and procedures. The second rule is security rule. The purpose of security rule is to ensure the CIA, confidentiality, integrity, and availability of electronic PHI information. The scope applies to entities, and the safeguards are administrative, physical, and technical. Administrative relates to policy, procedures, and training. Physical relates to access control and device security, workstation security. Technical relates to access control, logging, audit controls, integrity, and transmission. Breach notification rule talks about sending a notification within 60 days to the affected individuals. Then one notification need to be sent to Department of Health and Human Services, HHS. And if the breach affects 500 plus individuals, then notification need to be sent to prominent media outlets. The purpose of omnibus rule is that it strengthens HIPAA protections. The scope extends to business associates also. The key enhancements is tightening of PHI access, use and disclosure, strengthening patient rights by providing them with electronic copies of records, and increasing penalties of non-compliance for up to $1.5 million per violation category per year. Enforcement rule is all about enforcement. It establishes procedures and penalties for HIPAA violations. The scope is it is enforced by Office for Civil Rights (OCR) at HHS. The key provisions is that it provides OCR the authority to investigate complaints and conduct compliance reviews, apply civil and criminal penalties for non-compliance with fines based on severity, and encourages voluntary compliance through technical assistance. Transaction and code set rule talks about standardizing electronic healthcare transactions. The scope it applies to electronic transactions only. Example is claims, payments, and enrollments. The requirements is establish standardized formats and code sets like ICD, CPT, and PI. It promotes data accuracy and facilitates communication across healthcare providers and payers. Unique identifier rule in short talks about requiring an identifier for each provider. It's called NPI, National Provider Identifier, a unique 10-digit identifier for healthcare providers. Also talks about health plan identifier for identifying the health plans, and employer identifier EIN uses employer identification number for employers in the health transaction. All right, so today we discussed HIPAA, the purpose of HIPAA, scope. We talked about the full form of HIPAA, PHI, HHS, NPI, talked about what are entities, and we
discussed about 6 major rules that are provisioned inside Hipaa. I hope this information was useful, helpful, and thank you so much for watching.